Welcome to Talking Teeth, episode 5. Hope everybody's doing great. Had a great summer. We're back in September to do our education and to help a lot of dentists and a lot of dental students. So today's talk is about the dental students
at Nova and SU.
And at NYU as well, where we teach, and Columbia, we've been there, and UPenn.
Yeah.
So all these dental students over the years that we've taught to through FMR, we want to kind of let the public know what's happening with dental students and how the process goes, because we want the dental students to be helped and we want the patients to understand the value of education in all these different universities and how it's changing in the last 5 years, 10 years. So
I would love for you to tell me more about your involvement, specifically with Nova and SU, College of Dental Medicine.
So Nova, we started working with them back in 2012. Okay. And then I gave a couple lectures to them. About 5 years ago, one of my friends retired from New York and went down there and started, teaching there. And he said, "You got to come down and take a look at the school." So I said, all right. I came down. His name is Dr. Dan Feit, great dentist. And I said, I like it. The school was really nice. 3 years ago, my daughter says she wants to be a dentist, which was very exciting. Christina said, shout out to Christina. And she goes, "Dad, what do you think?" I said, "Apply to all the schools, go get interviews, look at the schools and see what feels comfortable for you." Right. I didn't want to push her one way or another. Yeah. She loved NSU, she loved the culture, she loved the weather, obviously. And that's where she goes to school. So now it became more of a presence for me to be there. So I committed once a month, 3 days once a month since 2000 and right after COVID, so 2021. So for 3 years now, I've been going down there once a month, teaching the dental students, teaching the prosthodontic residents, and the implantologists there, and the maxi course, that other courses are going down there. And it's been a lot of fun because I love the weather. And the people are nice. And it's a nice, thing to give back to the community down there. So it's really exciting.
Well, that's always big for you. And your office, so I think that's really good.
Yeah, and listen, we have a lot of patients that get snowbirds. They go down there in the winter, so they're excited that I'm going to be down there. I took my boards, by the way. I took my Florida boards. I actually failed the endo, so you don't want me doing root canals. And then I went back and took it, but I took the whole thing. I passed the whole thing. But I did fail the endo part, which is very funny because it was the easiest part. So all my root canal friends are like, "You can't do a root canal in Florida." I said, "I get it. I won't be doing root canals." So it was really funny. It was very interesting to take the boards after 30 years in practice, 35 years. It was very hard.
Yeah, I remember you studying.
I was studying for 5 months.
Yeah, you had to leave early for parties, dinners. We're like, wow.
I wasn't drinking.
No,
I wasn't partying. I was studying. My table had notes all over the place. Yeah. But one thing I did learn, I learned how to study for a test. When you're younger, you don't know how to study for tests. You just kind of memorize everything. Yeah. I learned how to study for tests, and I did good. I was very, very proud of myself, except for the endo.
We're proud of you as well.
So I got my license in Florida, so it's exciting, and now I could do more hands-on education. That's really what I was doing it for. I'm not trying to build another office in Florida, but I want to do my hands-on education, and to have your hands-on, you have to have your license.
Yeah. Well, speaking of hands-on education, what exactly are you teaching these dental students?
So it's 3 parts. There's the dental students, there's the prosthodontic residents, and then there's dentists that already graduated.
Got it.
So there's 3 different types of education that we're providing. I find that dental students are having an opportunity to teach the FMR kind of concepts, opens up the world for them because they can see the future of what they want to do, whether it's aesthetic dentistry or implant dentistry or prosthodontic dentistry. I think by having our team down there and our faculty, when they meet them, they start feeling that excitement of, oh, this is what I can do when I get out. So it's not just the dental school core technique. They have to learn that. They got to learn what they're going to, get out to take their test and become a dentist. But for them to be able to see exciting new dentistry, aesthetic dentistry, implant dentistry, occlusion, FMR cases, it's something I think they should see. Right. They should see and then see, hey, do I want to continue my education and do I want to learn more? Because I'm only going to get the basics in dental school. I'm going to do a residency for a year Maybe I do a specialty training, which is wonderful. We try to encourage them for specialty. There's a lack of specialists coming out of schools. FYI, there's a lack of dental specialists coming out. Some people don't have the money to go again for 3 years. It's very expensive. Some people don't want to spend 3 years. They want to just go to work. So I get it. But we're here to show them another path, the possibilities of what's available.
I want to get more into that. So how did they respond? How did they receive the FMR concepts?
I think it's received differently, right? Because you have students that are already dentists in other countries.
Okay.
So they're called foreign trained dentists that have to go through 3 years to become a dentist. So they kind of see it, right? Because they're already dentists. They're like 30, 35. Whereas the 22-year-olds are kind of shocked. But what I find is that some of them gravitate to it. They want to learn more.
Yeah.
And some of them are overwhelmed. And they say, hey, you know what? Let me just finish my dental school. I'll get to this later.
Yeah.
And that's fine. Our position is, here's what's available. If you'd like to learn more, we're here for you. We're here to teach you. They don't pay for the education. And anytime we're doing a course down there, we don't charge the student. They can come in and fill in the student.
That's
so they
fantastic.
can come in and see it and watch us. So it's really great.
Wow, that is really great. So why do you think it's important to teach dental students, even though they may not be able to perform these high-level dental procedures? Why do you think it's still impactful and important?
I guess I think about myself in my third year dental school, where I was exposed to like 5 great dental professionals, and I was excited. Yeah. I went to their office. I was reading stuff. I was into it. So I'm just projecting my enthusiasm to them. Maybe I find 5 or 6 that are like me. Some of them get it. Some of them say, yeah, I want more. Some of them say, I want to be a specialist. We have one specialist right now in prosto training that I met 2 or 3 years ago. And now he's training because it was all because of you. So I think if you could just inspire 1 or 2 or 3 or 5 of them, I think that's worth it. I think it's worth it.
Absolutely.
Yeah.
That's great. So what else do you have planned for Nova Dental School?
We have a provisional course coming in next year in May. We're going to do our FMR course, where the students can jump into the course. So dentists outside in Florida will pay for that course, and they'll take the course. But we want the students to come in and just join it and just see it. I was back in Tufts Dental School with Dr. Mike Appa.
Okay.
Hi, Mike. And we went to Tufts University. And in that class was a first-year dental student. And he met Dr. Mike Appa. He met Dr. Dean. And he was enamored by the whole aesthetic concept.
Yeah.
And this is how things are translated to our students. That dental student went on to finish second year, third year, fourth year, kept in touch with me and Dr. Mike App Aesthetic Advantage course and FMR. He went to residency at the Brooklyn VA, and now he works at our practice. Wow. Dr. Ari Katsubis.
Oh my gosh.
So Dr. Ari, I met in first year dental school.
Oh, I didn't know that.
So I think it's these wonderful things that I think FMR does, our faculty, all our faculty, Dr. Ellen Katz, Dr. Armin Akopian, Dr. Homa Faridnia, Dr. Joanna Heimreich. These are wonderful people that I think by having our FMR program and them seeing it as students, Dr. Homa's daughter is in with Christina. Her name is Nagin. She's in third year dental school as well. So we have faculty that have students in the dental practice, and I think again, just exposing them to things that are possibilities, I think really creates the curiosity. It creates them to try to see what their potential is. Yeah. Search new ideas, be creative, ask questions. You know, I mean, I think that's what it's all about.
Yeah, and that's so important that it means so much to you. And this is volunteer work that you do at the school, correct? At
the school, it's volunteer work. There's a small stipend that they pay us for our expenses, but it's not like, you know, we're making money there. Wow. It's a giving back of our time.
Yeah, I know that's always, you know.
Yeah, you got to give back. You got to give it back.
Like you. So that's all the questions I have.
That's it?
Yeah.
Well, let me add to your questions.
Okay.
You should be asking me, what do you see in the dental professionals coming out of dental school?
What do you see that? What do you see the dental?
I see the dental profession is really changing.
Yeah.
I see that the students are very digitally enhanced because we didn't have that. So they're very digitally enhanced. Some schools like NSU Nova has a lot of digital components. Other schools don't have it. So I always tell people, say I want to be a dentist, I said go to a school that has a lot of dental technology and digital enhancement in your education. Because when you get out, you got to do that. Analog is great, but digital is faster, it's better. Analog is a great way. You have to teach them the analog way because that's the basics. But the digital is really helping dentists get better faster.
Okay, are you seeing that the younger dentists, the students, are grasping and retaining the digital side of dentistry more than prior generations because of how they're growing up in such a digital focused age?
So there's two things about this generation.
Okay.
They're grasping the digital aspect of technology, but they want to go too fast. They want it today. They want it tomorrow. They want to jump ahead. They don't have
the generation of instant gratification.
They want it now.
Yes.
And I said, no, you got to take your time. You got to learn the concepts.
Of course.
Digital is going to get you there faster, yes, but get the concepts.
Behind it, you have to know why.
So I tell them it's not a sprint, it's a marathon. You got to go slow. So I got it. That's my modus with the students. They want it, which is great. Their enthusiasm is great. Their digital enhancement and knowledge is great. They don't have patience. They got to calm down. Calm down, take it slow, get the basics, and then you can run. Get the basics, get your 1, 2, 3, 4, 10 units, get it slowly, get it good. Go slow in the beginning, then you can speed up.
Yeah.
That's my advice to them.
That's great.
Yeah.
Well, I know a lot of your programs, all of your programs, FMR, any courses that you produce always have a social aspect to them and a community aspect, you know, dinners or group chats, things like that. Do you have something similar for the student group?
Yeah, so every student can join our group chat on WhatsApp, so that's really great. You can email me and I'll get you on there if you want to learn things. Because in the group chat, another great thing that we created in the group chat was dentists asking questions to dentists. So I say, hey, how do I do this impression better? And for a student to see that the dentist has been practicing for 10 years or asking the question, they don't feel embarrassed asking the question. The dentist will say, hey, how do I hire an associate? How do I buy a practice? What's the best scanner to use? So they see dentists 15 years out asking these questions. They don't feel embarrassed asking a question. They'll take a photograph of a patient and they'll say, what do I do here? I have this patient next week. So we offer that. That's a great service to be able to help another student, another dentist, help their patient. What a great way to learn and just share the knowledge. So again, there's no fee for these things. There's no charge. It's a group chat of people that really want to help, really want to learn, and it's an open forum, and they can ask any questions. So for them, again, digital has made it very easily to get information disseminated to the dental students. So it's a really great thing that we had. Another thing that you witnessed when Becca's in the office, we have students coming in. We have students from all over. There's a whole list and a calendar of students coming from different dental schools. And we invite them. We want them to see over-the-shoulder learning. Dentistry is a cooking type of profession. There's a recipe. I can do it one way, another dentist will do it another way, another dentist will do it another way. So for a dental student like I was, when I saw my one dentist do a procedure a certain way, it's like I learned their recipe. And then I went to another dentist who I really respected, and I saw his recipe. And I go, oh, so there's a couple different ways I can do this. Right? So how do you make an apple pie? There's 100 different recipes. So how do you make an implant crown? It's 100 different recipes. So over-the-shoulder learning, like a chef, when you watch a chef work, when you watch a dentist work, it's a project. They're making a project. So seeing that process as a student, it makes you understand that when you go to the clinic, you're going to be able to kind of either copy it or get it close to what you're trying to achieve.
Absolutely. And it opens a lot of more opportunities for students as well. We actually brought a couple students to observe our work in the DR that we spoke about in our last episode of Talking Teeth. Yeah,
so, I mean, what do you think about that as an outsider? Like, wouldn't you like to do an internship?
Yeah, I think it's incredible. I mean, obviously they're not qualified or have the experience to be practicing, but for them to observe that and be in the room and be able to ask questions and see it before they're ever able to do that in dental school or beyond is such a valuable tool you're giving them.
Yeah.
And it's really a unique, elevated experience that they can't find anywhere else. And I know that you select them based on people who show initiative, who are passionate.
You got to
who
show
are-
initiative.
And it was
Yeah.
really exciting because those are the people that want to be there, and seeing them there really was incredible. And I
Yeah.
know that you treat all of your students with that respect.
Yeah, but you know, it's interesting. I do always wonder why one student comes and shadows for a day or two and then never comes back. And then others keep knocking on the door and say, can I come back again? And I say, no, well, there's somebody else in line. You know, you can come back next month. It's just, I guess it's a personality thing. I mean, I don't know what it is, but I was, when I got an opportunity to go learn from Dr. X, I was there. And he said, come to my office. And I said, are you sure? Really?
Yeah.
I can come? They go, yeah, come to the office. This is awesome.
Yeah.
So for me, I was just Mr. Curious. I always wanted to learn. I always wanted to see what they were doing. I knew it was different than school. I respected the school, and I did what the school told me, and I got my core technique down. But I always was curious, what are they doing? What is that guy doing? What is she doing?
Right.
How do they build their office?
Right.
How do they get patients? I was just very curious, and I think having that internship kind of shadowing program here at New York Smile Institute, I mean, we've been doing it since I was out of school.
Wow.
You know, we've had students come in since I was out of school, and some of them became great professionals. It's really great to watch.
When you were in dental school, was there anything remotely accessible like this to students?
There was 2 or 3 doctors
Okay.
that
Wow.
that would let us assist,
Yeah.
and they paid us,
Oh wow.
which was nice.
Yeah.
Because you know a lot of dentists who were teaching back then were teaching part-time, and they were working part-time, so they were working 2 days a week. They couldn't get an assistant to work 2 days a week. Most assistants want full-time jobs.
Sure.
So they'd hire dental students
Ah. Okay.
because you know they can get this dental student from Monday from 8 to 12,
Right.
another dental student from 1 to 5. So they kind of picked all these
Yeah,
dental students
yeah.
to have an assistant. They didn't have assistants.
Yeah.
So that's how Dr. Gary Goldstein, I mean, maybe he's going to watch this show. He was a great role model for us, and still a great role model for me. I still call him, who really took time to really teach us. And that's why I think I'm influenced by him, the way I teach. Like I was taught this really by great people, and I just feel it's my responsibility to give it back. You know, because it just feels good when you see that other student excelling and doing great because they learned your technique. So I mean, it all comes back to giving back.
Yeah, absolutely. Well, thank
Yeah.
you so much for sharing that with us.
Yeah.
It's really evident how important all of your students are to you, and the way you give back is just absolutely incredible.
Yeah. So
Um,
thank you for listening. Next time we'll be talking about, I don't know, what's our next episode?
Dogs.
We're trying to get the dogs in here
Dogs
and
and
the pets and talk about their teeth.
Pets
So
and
hopefully
vets.
that'll happen. Pets and vets. Thank you, everybody. Have a great day, and thank you for listening. Cheers.